The cephalic is the head. The frontal is the forehead. The nasal is the nose. The buccal is the cheek. The oral is the mouth. The cervical is the neck. And the mental is the chin. Can't really see it. The acromial is the shoulder. The sternal is the breastbone. The axillary is the armpit. Thoracic is the chest. Mammary is the breast. The brachial is the arm. The antecubital is the front elbow. The olecranial is the back elbow. The antebrachial is the forearm. The popliteal is the posterior knee. The sural is the calf. The carpal is the wrist. The palmar is the palm. The pollex is the thumb. The digital are the fingers and the toes. On here is just fingers, but they're the toes as well. The patellar is the anterior knee, which means the front knee. The crural is the leg. The tarsal is the ankle. The hallux is the big toe. The occipital is the base of the skull. The vertebral is the spinal. Is the spinal cord. The scapular is the shoulder blade. The lumbar is the loin. The dorsum is the back. The sacral is the area between the hips. The femoral is the thigh. The calcaneal is the heel. And the plantar is the sole. Next we have the directional terms. So anterior, our ventral is the front. Posterior, our dorsal is the back. The superior, our cranial is the upper. Inferior, our caudal is the lower. Next is the medial, which is the midline. So I drew two arrows pointing towards the midline, which is the middle of the body. Lateral means away from the midline, so it's going outwards. Next, the intermediate is the area between the medial and the lateral. So the medial is going inward, the lateral goes outward, so it's the area between there. The distal is the point away from the origin, and proximal is the point of origin, so that means it's closer to the origin. Superficial means external surface, so that would be like a cut or something. It goes, and deep means it goes really deep inside the body. So next up we have the body planes. The first body plane is the sagittal plane. So the orientation of this plane is parallel to the long axis. It could be called the corona as well. When it's called the mid-sagittal, it means it goes straight down the middle of the body at the midline. And if it's parasagittal, it means it's to the left or to the right. The next one is the transverse plane. This one is perpendicular to the long axis, and it just cuts the body, upper half and lower half. And the last one is the frontal plane. So this is diagonal to the long axis, and it could also be called oblique.